Good morning, everyone. Welcome to this new day. I hope you all are doing well and staying safe. This is John J. For those of you that are seeing me for the first time, and I am back. Today, I want to be discussing about hepatitis B. Now, I'm not sure if a lot of you have heard about hepatitis B, but what hepatitis is an inflammation of your liver. The word hepatitis means inflammation of your liver. So in a sense, hepatitis B is an infection of the liver that's caused by the hepatitis B virus. Okay, there are different types of hepatitis. There is hepatitis A, there is hepatitis B, there's hepatitis C. But today I want to be focusing on hepatitis B. Now, hepatitis B is very, very contagious. If you are in the healthcare field, or if you work in any healthcare settings, you will know that hepatitis B is one of those infections that you will be on isolation for. Okay, we don't isolate. Generally, they don't isolate a patient for HIV or AIDS, but if you do have hepatitis B, you will be placed in a room all by yourself on isolation because this disease is very, very contagious. So like I said, it's caused by a virus, the hepatitis B virus, and it can be contagious because outside of the body, it can still survive for up to 7 days. So that's why this is a very serious condition. Okay. So if you're wondering how this virus is spread, it's spread when you come in contact with blood, open sores, or body fluid from someone who has the hepatitis B virus. So if a person has the hepatitis B virus and happen to, cut themselves or their body fluid drop on the surface, even if it looks like it's clean, that virus can still live on for up to 7 days. This virus can be acute, meaning it can last for a short time. So sometimes if you do get it, you may not even know that you have it. Your body can fight it off in some cases, and that's when it's in its acute stage because it lasts for a short time. In a couple of months, your body fight it off and you build up immunity to the hepatitis B virus. But it can also be chronic. Okay. When the hepatitis B virus becomes chronic, it causes scarring of your liver. It's like when you have a cut or a sore on your body and it's healing, it develops that scar on top of it. That's what it does to your liver. If this virus becomes chronic, if it's not detected early enough, it can live on in your body and cause scarring of your liver. And when that happens, it can lead to liver failure and ultimately cancer. This virus can be life-threatening because, if your liver fails or if it leads to cancer, we all know the outcome. Okay, liver cancer is very serious. So this is a very serious condition. Sometimes, like I said, your body can fight it off and you can build up immunity to it without even knowing that you have had or you've been exposed to this virus. But if your body does not fight off this hepatitis B virus, if it goes undetected for a period of time, then it becomes chronic. A key thing to remember is hepatitis B infection does not always have symptoms. So somebody may have the hepatitis B virus and may not even know that they have the hepatitis B virus. Okay, but if it does have symptoms, if you have it and you have symptoms and you're wondering what are the symptoms of hepatitis B, if you have that virus, one of the symptoms are jaundice. I'm sure we've all heard about jaundice, what it is. If you are listening and you do not know what jaundice is when your skin or the white part of your eyes become yellow, or your pee, when you urinate, it looks brown or orange. So one of the symptoms of hepatitis B is jaundice. Another one is your poop can be light color. So instead of it being brownish, it will be light color poop. Sometimes you may have fever, you may be extremely tired, and most people with hepatitis B often have stomach issues. So most time they will be feeling nauseous, and nauseous is just it's when you feel like you want to vomit. That's the medical term for feeling like you want to vomit. It's nauseous. So some people may experience that nauseated feeling in the belly. Some people may even vomit. Sometimes you will have loss of appetite. You have stomach pain and joint pain. So those are the symptoms of the hepatitis B virus if you do get to the point where you start having symptoms. But again, many people have the virus. A lot of people have the hepatitis B virus, but don't know that they have it. But the only way that you can find out if you have this virus is by getting a blood test. So which is a test to check your hepatitis status. So they will check your hepatitis B antigen. If that hepatitis B antigen is positive, that means you have the hepatitis B virus active in your body. Okay, so this test is not routinely done by your healthcare provider. So unless you start having symptoms that indicate that it could potentially be hepatitis B, but other than that, it's not part of the routine test that your doctor does. So it's important when you go to your doctor, you ask the doctor, what is my hepatitis status? If the doctor does not have any record of it in the system, you can ask the doctor, is there any way that you can check my status because I want to know where I stand? It's a simple blood test, and that blood test is called the hepatitis panel. So it will tell what your hepatitis B antigen is, and if that antigen is positive, that means you have the active hepatitis B virus. And it will also check your hepatitis B antibodies. If you have positive antibodies, if that number is greater than 10, that means you have some protection against the hepatitis B virus. Now, that protection can go down over time. So it's important that at least annually, you ask your doctor to check your if you are not hepatitis B positive, if that antigen is not positive, annually ask your doctor to check your hepatitis B antibody, because that antibody indicates that you are immune to the hepatitis B virus, meaning if you come in contact with the hepatitis B virus, more than likely you will not become infected. Some people can develop natural immunity in their life. And the way that happens is maybe somewhere down your life, you got exposed to the hepatitis B virus, your body fought it off, and then you build immunity to it. Immunity is pretty much protection against the hepatitis B virus, and that if your body naturally develops immunity to it, you protect it for the rest of your life. And that one is when your hepatitis B core antibodies is positive. All right. So there's 3 main blood tests that's part of this hepatitis B status, which is your hepatitis B antigen, your hepatitis B antibodies, and your hepatitis B core antibodies. If the antigen is positive, that indicates that you do have the hepatitis B virus. It's not part of your routine blood test, so it's important that you ask the doctor to check it for you, all right? Know what your status is, because this is a very serious infection that you may not even know that you have it. So if you're wondering, what are the common ways that somebody can get hepatitis B? So the most common way that you can get hepatitis B is by having unprotected sex with someone who has the hepatitis B virus. They may not know they have it, or they may know they have it and choose not to tell you that they have it. So the most common way is having unprotected sex with somebody who is positive for the hepatitis B virus. Another way you can get it is by sharing needles with someone who is positive and not know that they're positive, or if you get accidentally stuck by a needle that's being used by someone who is positive, or for many of us that work in a healthcare system, if you are drawing blood on a person and you accidentally poke yourself with that needle and that person was positive to the hepatitis B virus, you can potentially become positive. It can also be spread. If a mother is positive and during pregnancy, a mother can pass it on to her child. Okay, and remember, you can spread the virus even if you do not know that you have it. A key thing I want to throw in there is that hepatitis B virus studies show that it is not spread through kissing, through food or water, sharing utensils, which is your eating spoon, fork, or any of those things. It's not spread through coughing. It's not spread through sneezing. It's not spread through touch. The most common way, like I said, is having unprotected sex with someone who is positive, sharing needles, accidental needle sticks, and if a mother is positive and is pregnant, she can pass that on to her child. But there is good news at the end of the tunnel. There are vaccinations that you can get that can protect you from getting the hepatitis B virus. So if you check your status and you are negative, please do ask your doctor to get those vaccinations. It's a series of 4 vaccinations that you can get every month. So the first 3 vaccination you get every month. So let's say if you get your first one this month, we are in June, your next one will be in July, your next one will be in August, and then the last one will be in September, October, November. Either November or December will be your last one. So there are vaccinations out there that you can get to protect yourself. That's one vaccination. If you are if you are against vaccination, that's one vaccination I will highly recommend that you get. So talk to your doctor, talk to your healthcare practitioner, get yourself protected, know your hepatitis status. Thank you so much. I hope this was helpful, and I look forward to coming back with my next video. Bye. Everybody take care. Thanks for watching.